therapists, join us at the Chronic Illness Therapist Conference this March 6th and 7th, 2026 in Atlanta, Georgia, or virtually. This will be an interdisciplinary CE-based conference that's bringing together mental health professionals, physical therapists, registered dietitians, and allied health professionals who want to deepen their skills in chronic illness-informed care, which goes way beyond just trauma-informed care. Earn continuing education credits while connecting with colleagues who truly get it. Registration is open now, and you can visit Chronic Illness Therapists, plural, chronicillnesstherapists.com to sign up and also read all about the accommodations that we've built into this conference to make your in-person experience as comfortable as it can be. The Chronic Illness Therapist Conference is where clinical excellence meets community, and we are so excited to have you. Therrien is a holistic physical therapist and health coach who specializes in treating individuals with chronic pain and complex conditions. He works currently in the field of pain management and has earned his Doctor of Physical Therapy from the Medical College of Georgia in 2011. He's a certified therapeutic pain specialist through Evidence in Motion and a certified health and well-being coach through the Well Coaches Corporation. Jason has a passion for understanding and treating pain as he has seen the devastating effects of persistent pain on his patients and loved ones alike. His approach to helping those live with persistent pain is multidimensional and incorporates education, coaching, and psychologically informed practices. His ultimate goal is to empower his patients with knowledge, strategies, and tools to more independently manage and reduce their pain while restoring function and quality to their lives. Jason aims to share the pain insights that have helped so many patients with other healthcare practitioners and wellness professionals in order to minimize the unnecessary suffering that exists in this epidemic of chronic pain. And I can attest that Jason is all of those things, as he has been a part of my clinical consultation group for 2 or 3 years now, and I have seen firsthand how much compassion and knowledge he has about chronic pain, especially for somebody who has not experienced it himself, but has seen it, like he said, with his loved ones. And I think it's really impressive how much he understands this condition, both psychologically and physically. So I am excited to welcome you all to this episode of the Chronic Illness Therapist Podcast. The Chronic Illness Therapist Podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learned here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence. Okay. All right. So Jason, thank you so much for being here. You've done the podcast before. Obviously, we've done workshops together, podcasts, and you've been in my consultation group for forever now. And so I know a lot about you, but my audience might not know a lot about you. So I would love for you to share a little bit about your practice, what you're doing these days, and what kind of clients you tend to work with.
Yeah, thanks for having me. My name is Jason Therrien, and I am a physical therapist and also practice health coaching. I take a holistic approach. My focus for many years has been on chronic pain, which when you're working with that population, with people who experience chronic pain, you also see a lot of other issues like chronic illness, and layering in, you'll see stress and other mental health conditions that might also be relevant to their physical health experience and symptoms. So I work with folks predominantly with chronic pain through a holistic lens.
Thank you. What are some of the main things you tend to hear from people around their pain, and kind of how that, your whole thing is seeing the relationship with one's body. And so I'm curious, what are some of the things you start to hear people say that kind of give you this, oh, that is indicative of you are not doing so great in that relationship right now?
That's a good question. I think have tos come up a lot. So whenever I hear things like I have to, I don't really have a choice. I have to keep pushing through. I have to keep I have to finish this job, whatever this task is. It might be working for an employer, or it could be some kind of housekeeping responsibility, yard work, whatever it might be. Um, the idea that you have to do it one way, or that you have to complete it, is usually a good sign that, from my experience, that person has not been really paying close attention to how their body feels during different activities. Um, Not to say you have to be like super vigilant the entire time, but just a bit more attuned and aware of how your body is responding to the activities that you're engaging in. Um, so have tos, musts, oughts tend to be challenging territory for that relationship to one's body, which I think sometimes it's maybe easier for me to think about what the more ideal or wholesome relationship might look like and what deviates from that. So a more wholesome relationship, or one that I would say is also strategically more sound to get what you want, if you want to be more physically active and engaging, and to live the life you want to live, or be the kind of person that you want to be, it will require listening to your body and understanding what it's telling you, so that you can be more responsive to it as you're engaging in those activities. Um, for those who don't listen, they may get things accomplished, they may get some jobs done, but at the expense of flaring up their symptoms a lot of times. And then it creates kind of a cycle in that way.
Yeah, it makes me think the people you're describing right now are the people who maybe don't know how to feel what they're feeling, pushing through, right? They have to kind of ignore or like dissociate from even what they're feeling in order to keep pushing past the pain to get a certain thing done. And then on the other side of that, can you explain maybe what it might look like for somebody who actually thinks about their pain a whole lot, and like is the opposite end of that, where they actually feel like they can't do anything, and maybe they yeah, can you describe that kind of what that kind of relationship might look like?
Yeah, that's true. That does happen pretty often too. That some folks, as a result of their the symptoms that they develop over the course of time, it can dominate their focus of attention and be at the front and center of their awareness, which might prevent them from doing as much or doing the things that they care about, that they want to do. For those folks, a lot of times what I've noticed is it's partially the symptoms themselves, or the sensations that they're focused on, but it's also the story behind it, the relationship to it, that really fills up the rest of that space. So there's the sensation in their back, and the part of them inside that's really concerned about that, or resistant to it, or maybe preoccupied with what might happen if they were to, go to that party or get on that plane to go visit family. Yeah, so if that responds to your question, like, some folks will just be in that space of, yeah, just rumination a little about their experience, what they're having, and some concern, or I don't like the term, but catastrophizing as to what might happen next if they were to engage in activity more often.
Yeah, I think that's, we can talk about that term for a minute because, and the reason why you and I both don't like that term is it pathologizes the client. It says you're doing something wrong, and, you're just being dramatic, or you're making things worse than they are. But if somebody doesn't quite understand or know, I mean, we have been taught, right, that pain equals bad, emotional pain, physical pain. And so, yeah, like when my back is hurting, that might be a signal that, okay, you need to go sit down, even though maybe the reason why my back is hurting, my particular back problem might be, a shortened muscle somewhere, or a tightened area, or somewhere that's too loose, like when in hypermobility. And so then sitting down actually does the opposite, maybe. But also pushing through the pain maybe turns into, still kind of doing something that just doesn't give your body the rest and restoration that it's looking for, which is where I always think, even though you do a lot of psychologically informed practices around body relationship, this is where I think the knowledge of the body comes into play so well. Um, can you just give an example of what that might look like? What kind of movement you might be working with a person who is you're actually trying to encourage them to not be so scared of certain sensations in their body.
Yeah, yeah. It's a good question. Yeah, one gentleman comes to mind who kind of on the further end of that spectrum of being afraid of certain motions or certain positions for his body, mostly as a result of, okay, so he develops pain and then he goes to see some, I think, well-meaning healthcare providers who then inform him that certain motions are off limits or these can put you at risk of causing more damage or more issues. So he takes that and he applies it to his whole life for the ensuing months. He comes to our sessions and won't sit down the entire time because he's been led to believe that any sort of bending or flexion of his spine would be dangerous. It would actually be potentially causing more damage to the discs, which would then cause more symptoms for, again, a lot of his issues are in one leg. So in that situation, I I know I've used this term with you before. I don't have a better term, but like radical grace. I think for me, the first step is just to recognize and not pathologize what beliefs you do have with about your body and about your pain and about what you've been told related to your diagnoses and your prognosis from that. Um, and also the feelings that come from that. It's like, well, if you have a bad back and you have all these different diagnoses that are scary and hard to say because they're all in Latin, it can lead to a lot of understandable fear and frustration with your body. So let's start by just honoring the fact that there is that there is a there for those big feelings, and they're not wrong to be there. Um, so to me, I think of it as like a twofold project. One part of the project is to honor and have compassion for those feelings and the relationship that is already present with the body and how we relate to the symptoms we're having. And then the second part of the project is to restore a relative sense of safety and strength and confidence and resilience in the body. So for this person, even the smallest amount of flexion in his spine, even in a standing position, was a lot for him just to even consider. So I don't do this often, but for those who it's appropriate for, I'll use motor imagery, which I'll ask the person to imagine doing the motion, which even imagining doing it can evoke both increase in their symptoms. They'll experience an increase in pain sometimes, and they'll notice the fear that comes up inside. So they might feel tightness in their chest or the throat closes up or something like that. So learning to recognize the strong degree of anticipation that's occurring in that person's system, which isn't their fault. It's not their responsibility they didn't put it there. In other words, they can do something about that. They can learn to work with those feelings. But I don't want anyone to leave this conversation or working with me thinking that they're doing anything wrong by even having these fears. Like that, most of that was conditioned into them earlier on, not by their choice.
Yeah, and that brings me to my next question. And of course, it's an individual question, but how do we start to figure out when pain is, quote, wrong? And I know you hate the wrong language. I do too, to a sense. But like, if I bend my finger this way, that's not wrong. But if I keep going, that's going to be pretty wrong. I might break my finger. So like, how do you know where that line is, especially as someone with chronic pain? I've had to learn this for my own body, but like, I can barely put it into words because it's been such a long journey.
Yeah.
So I'm just like, yeah. And maybe you have a different way of answering that. And that's totally fine too.
I'll take a stab at it. But it's not an easy question because, well, I mean, yes, I'm not going to reject the language, but I don't think about it as right or wrong. Pain, it's real. It's right in some form or fashion. I think about, to answer your question, I think you could probably approach it in a couple different ways. I think some of it does require a little bit of just better understanding of how pain works. It doesn't have to be like a super thorough neuroscience explanation, which I've done that too. And sometimes it helps and sometimes it doesn't. But in general, pain is more about sensitivity than it is about damage. So your example with the finger would just be, I would just pick up on the example. Say, okay, well, if you bend your finger back to a certain point, it will start to be sensitive. It'll start to feel uncomfortable. And if you keep going, it's going to start to hurt. And it's probably going to hurt around the time that something is starting to get stressed or strained. So if you start pulling on the tendon or the ligament or the fascia, and it gets to a point where it's undue, like it's beyond what it can take, it might start to tear, and that pain would represent fairly well the amount of damage that's being incurred. But we also know that depending on the person and the health of their nervous system and the level of, let's say, activation in their system, sometimes we might think about that as level of threat in their system, that can actually, that the point in the range of motion for that finger to start becoming painful might be a little earlier or might be a little later. So it's going to hurt at some point. The pain doesn't necessarily mean that you're immediately starting to have injury or damage, but it's a sign that if you keep going that you might. So how did you might relate that to a person's area of chronic pain. So if they have chronic low back pain, and some days it's really sensitive to the touch and other days it's not. Some days they can do a lot more physical activity and not really pay for it. And sometimes they can't. I think one way of maybe starting the conversation there is just using their own experience to help them see that maybe the sensitivity in their system is what's changing in those situations. And now we can have a conversation about that part of the pain. So yeah, let me stop there
Yeah.
because it gets a
Yeah.
little bit more nuanced from
Yeah.
there.
No, that's perfect. It makes me think of too of the the pain. Well, we use this a lot in with MCAS, but there's like the theory of the bucket, and once the bucket is full with environmental or physical or emotional stressors, then symptoms overflow, and that's so I like that you talked about this being dynamic as well, where one day doing the dishes can be well within your range and you can do the dishes and then go to the park with your kids, and other days you're doing the dishes and it's like the pain is already, the sensations, the pain is already starting to kind of fill your body. And maybe that's because you didn't have a good night's sleep. Maybe it's because you're dehydrated. Maybe it's because you had a really big fight with somebody that morning. Maybe like the stress bucket is getting full, and sometimes we know what is filling our bucket up and sometimes we don't. And so regardless of whether you know or not, we do need to learn to listen to those sensations, which doesn't always mean stop what you're doing right now because you're going to hurt yourself. Sometimes it does mean that. So that's what I'm getting from what you just described.
Yeah, yeah, and I, it's a little tricky jumping into the examples without kind of laying out the foundation for how I encourage folks to approach movement and their own body. So if it's okay, I just want to just kind of lay that out
Yeah.
first. Okay. So I use a lot of dumb metaphors to explain things, which I think are fun, but my favorite is probably the bear. It starts with this idea that for folks with chronic pain, they've tried physical therapy a lot of times before they get to me. They will have tried pushing through the pain to get things accomplished in their life. But whatever the case is, when they push their bodies and it flares up their pain, that's what I call waking the bear. So from my perspective and how I like to work with people, our first step or our primary project is to calm the bear or calm things down in your body first. But then eventually, after we've made some headway in that department, which we tend to do so, then we're going to need to build the body up in order to restore that resilience and to be able to do the things you care about. And also along the way, develop more confidence in your body and belief and trust that it is safe to use, at least to some extent, including the areas that hurt. Well, to do that, it's going to be hard to avoid pain. It's going to be hard to avoid some degree of increased symptoms. So what I like to say is I want to teach you how to poke the bear without waking him up. And that's another way of saying I want to teach you how to be a good partner to your body, which means learning how to listen to it, understand what it's telling you, and then ultimately be responsive to your body so that you aren't pushing through, but you're also not avoiding activities either. You're able to make changes at the time or maybe between bouts of activity so that you're not just, again, getting the same result over and over again, that you can make the subtle changes necessary to do a little bit more over time and not hurt more over time as well.
That was a really good clarification. That I think is answering some of these really hard questions. Yeah, it may not be completely black and white, but to say learning how to do more without hurting more, I think that's everyone's goal, right? We don't want to do more and be miserable while we're doing it. So we are kind of moving into this, even the second objective here, but part of what clinicians can do with clients is exactly the education that you just shared. And you have a wonderful handout on the bear, which I'm happy to link in the show notes of this podcast episode. And people can use that with their clients to help explain this kind of education. What is the benefit that you see in laying out that education with clients before you ever start to do any manual work or movement work or anything like that?
A few different things. One, I think probably the biggest one, when folks come to see me, as I mentioned, they typically have tried a lot of other things before working with me, including physical therapy. And just me explaining things in that way at the beginning helps them see that this won't be like their past experiences, and that whether or not it's better, it's definitely a different approach. This weird guy uses metaphors about bears. Okay, let's roll the dice and see how it goes. So it lightens things up a little bit too. It's a different way of referring to pain throughout the activity, which I think there's some stock to that notion of not reiterating the word over and over again, which is not the same thing as saying, don't talk about pain to anybody. You should avoid talking about it. There's some schools of thought out there that encourage that. I'm not a fan. But it is just a different way of talking about it, which can lighten things up a bit. And then, I think when a person has a plan, it makes the trust that's necessary to go through the process of maybe reintroducing previously scary activities or movements or positions. It makes it a little bit easier if they have a plan that makes sense to them early on. So for all those reasons, and probably some that I'm forgetting, it's just helpful from my experience within those first 2 or 3 sessions to just create some clarity around not as much what we're doing, it's like as in like the specific exercises or movements, but why we're doing them and how that then shapes the way you do them. I like to say that the why and the how matter more than the what. You can give 3 people with the same diagnosis, although their experience will be different. But if you give 3 of the same person in 3 different universes, the same exercise, but you give them different explanations for how to go about doing them, or maybe frame their pain in different ways. One, maybe with this more, bear-like explanation, or one where just whatever they already believed about it. That will then shape how they go about doing those exercises. And I think it's really important that we talk about first why we're doing what we're doing and how we go about doing those things, if that makes sense.
Yeah, I love that that's your approach because, like you said, there are some programs out there right now that are teaching, I mean, literally behaviorally teaching clients that they are not allowed to talk about their pain. And it's incredibly damaging. It's psychologically damaging. It's traumatic. And it's interesting because as I've gone through my own chronic pain journey, I came to at one point where I recognize that certain movements, especially in the gym, certain movements that I used to think were like dangerous for my body, that were going to cause harm and injury. I, at some point through pacing, breath work, like nervous system regulation, through learning about my body and learning about muscles and how they work and all of that, was able to come to a place where I was like, oh, that particular pain I'm experiencing right now is not indicative of injury. But if anybody had tried to tell me that when I was in a level 10 pain from that experience, I would have been like, go away. That would not have worked. And so I would never advocate, like that's what these kind of some of these behavioral programs do, is try to help people see that their pain is not indicative of injury. And I just think that that is, it's not all, it's harmful at worst, and at best it's just not helpful. It doesn't do anything in that moment. A client has to come to that on their own, because some pains are indicative of injury and some are not. Even as I'm saying this in that example, I'm like, yeah, but if I had done some of those movements in the gym before and pushed past that pain, I probably would have tweaked something, maybe pulled a muscle or this or that, because I was pushing past my capacity at that time. So,
Yeah, I 100% agree. One of my favorite expressions to say with people is that pain is gray. And that's just makes sense to me, but the idea is that pain is never a black or white phenomenon. It's never just what shows up on your imaging, like your X-ray or your MRI or your posture. And it's also not just something unrelated to it, or something that's all being driven by a a belief that you've developed about your pain, or something that's again unrelated altogether in terms of your relationship, or something more emotional. I think these sometimes can be true. I mean, it's probably more the exception than the rule that there is a black or white case to be made. Most of the time, I would say it's a gray picture, that you may have some degree of structural abnormality in either current or a history of injury in that area. And you also have a nervous system that's really good at remembering where you've had previous injuries. And then there's things that affect your nervous system that have nothing to do with the injury that can, make it more or less sensitive. So it's always better, in my opinion, to look at the whole thing as a gray picture with multiple contributing factors or drivers, and then focus in more on where a person has the agency, where they have more say so. And sometimes just completely changing and committing to a new belief about their pain and what it does and doesn't represent is not within a reasonable expectation for that person. And like you said, it can be even harmful at times if they're being led to this notion that you just have to think about it differently and it'll go away, or suddenly become less significant.
yeah, definitely. Is it any of your techniques with patients around helping them see, for example, something like where they have a full range of motion in a certain area of their body? Like, for example, the guy that you were talking about felt like he couldn't, move or move his body in a certain way. With him or somebody else, would you advocate for helping them start to find areas of their body that just simply don't cause them
Mm.
distress? Is that
Yeah, there's a technique from the somatic experiencing world that comes to mind called pendulation. And that's not exactly what you're describing, but sometimes it is good just to recognize that you have a lot of real estate in your body. And in terms of what you can experience, it's almost infinite what you can experience in your body. So if you look long enough, you'll find something in your body that's at least neutral, if not relatively comfortable. And, I understand how some people might challenge that, but from my experience, eventually we'll find something that isn't threatening, at least. And I like to start with breathing, because for the majority of people, not everyone, breathing is a physical experience that you can feel in your body that is usually not associated with distress or threat. It's usually the opposite. It's something that's replenishing and helps you maintain, keeps you alive. It's something that you can just switch off from thinking about, and it will keep happening for you. So if you can focus on your breath, that's a good starting point for reconnecting with your body in a way that maybe starts to restore a sense of collaboration, that you can work with your body and your body can work with you. And then also from that, starting to recognize other things like your patterns of breath holding and how that oftentimes correlates with tension patterns in your body. So that's a whole nother question that you didn't ask. But as far as just
no?
reconnecting
I mean,
with good things in the body, that's probably a good starting point for a lot of people.
Yeah, absolutely. So basically another technique you're using is helping people become aware of their breath. I'm hearing it's not even about, this box breathing or that 470. It's just, can you even just notice how much breath your body does allow you to take in and notice that breath keeps you alive? I liked when you said that. It was like a good positive kind of imagery of, because I actually do have quite a few clients where breath is not like breath work isn't not it doesn't feel safe for them. It doesn't feel like a good entry point. But I could see how even that reframe of like, I'm not asking you to take this big, deep inhale, because that's a lot of times what people think we're asking. And they have been asked that by many other practitioners, right? Like deep belly breaths, right? They might not be ready for that. I know I certainly wasn't. The first time that I ever tried deep breathing, I was laying down flat on my bed and I took deep breaths in and I thought I was going to throw up.
Mm.
So I don't know what was happening there. If my diaphragm was just like, whoa, you've never done this before, like chill out. But it was nauseating. And so I think there's that. And I've had clients who have mentioned an array of different experiences. But just to be able to say, your breath is fine as it is, just notice how it's keeping you alive is, I think, really important.
Yeah. Can I speak to breathing for just a moment? Yeah.
Yeah.
Um, I think this is another one of those starting point conversation, like to the work I do is just talking about the breath, even just from an awareness perspective. So I do invite folks to try a breathing technique, and it's different than the ones that you listed. It's doesn't necessarily make it better, but it's intended to be less regimented, less technical. I call them the deep and easies, which kind of hopefully is implicit that they're intended to be very easy to perform. It does start with a slow, deep breath, but one that feels right to your body. If you take a super duper deep breath and become nauseated, um, that's not what you were asked to do. And that might be something for you to learn from. It's like something in you decided that it would be better to take a bigger breath. So there might have been some striving there, just really overcommitting to trying to do more. I mean, each opportunity, each time we do anything is an opportunity to kind of reveal more about what our intentions are with what we do with our bodies. So I'll have them try the deep breathing, and for most, even those who have some difficulty with breathing from their past experiences, or maybe have like a diagnosis, some kind of pulmonary issue, for most people, it's actually, pretty relaxing and calming, although that's not necessarily the main reason for it. Yes, it is a tool or a resource that I try to give folks to help them learn how to relax their body, learn how to change their breathing pattern, learn how to maybe calm their system and maybe get to sleep a little easier at night. But the main thing goes back to your point about just being more aware. And that the more you practice the breathing and you go through the recordings I offer people, the more aware you'll be of your habits of breathing throughout the day, when you hold your breath more, when you might hold tension in your body, because it's also a call to start recognizing how you hold tension. And a big part of what I do to help, going back to the bear metaphor, calm the bear, is to help folks learn how to relax their bodies. And for many, I'd say most, when they learn to go from this, like their body's held tight like a fist, to this, where their body's more relaxed and soft, their symptoms start to change. And that is a really nice talking point for us to explore. It's like, well, what does that mean about the nature of your pain? But more importantly, maybe what's going on upstream in these instances that's driving the tension and breath holding. And that gets into a bigger conversation about, your relationship with your body and the relationship with your symptoms and certain activities and movements. And then on top of that, we tend to hold our breath in certain circumstances and around certain people. So it's just, it's a great way of cracking the door open to a bigger conversation about personal awareness and all the things that might be driving their symptoms.
Yeah, thank you for that. And then in the mindset of the practitioner who's, listening to this and trying to think about how do I, incorporate this with clients, I had a thought about the way that you were very careful and cautious to like uh to not critique, but to, critique my breathing there. But it wasn't a critique. And in fact, if I had, I think somebody, when I first started doing all this work, all I had was like YouTube and, my own learning, which is great in a lot of ways. But if I had a practitioner who could have sat next to me and said, whoa, it's okay, you don't have to breathe in that deep, they could see maybe that I was trying to kind of be an A+ student, or and they could do that without judgment, without, it's not a judgment, but it was a fact that was what I was trying to do. And so to be able to call that out in a gentle, kind, compassionate way, and I know compassionate reframing is also one of the techniques that you use with clients, that in and of itself goes so far. Like, to give a client permission that an A+ actually is like a quarter of the breath that you just took. And so anything above is just, you're okay. You can do less and be beautiful. So I just wanted to point that out.
And you're still lovable if you don't get an A+.
There you go.
Yeah, I like the term compassionate reframing. Yeah, I think one of my, I guess, cheesier things that I encourage folks to consider is that at the top of your list for your homework in between each of our sessions will always be grace. And that's grace for yourself for not having done the homework. And then, and this is the trickier one, grace for the part of you that doesn't have grace for you. So the part of you that's very judgmental and shoulding and, yeah, be a bit of a critic inside. The part that may have driven you to get those A+, like, what a good friend. This part of you has your best interest in mind, wants to protect you, wants to keep you safe, wants you to be seen as valuable. Whatever it is, I like to take folks through an exercise called the charity challenge. What's the most charitable thing you can say about this tendency to push yourself really hard sometimes? And it's hard. It's a challenge. But once you look at it closely enough, it was never the problem. It was always the way it became the way that you found safety, or you found, a sense of connection in your life, perhaps. So it in and of itself is not bad or wrong. It might be in need of updating. And I think it's also easier to make these changes about how we use our body and not striving and not pushing quite as hard if we start with grace. I like to say grace leads to growth, but shame leads to more of the same. And
I love that.
It's just an important, I think strategically makes sense, but it's also, my bias is that we all deserve more grace from ourselves and acceptance from ourselves and compassion. So, yeah.
I love when you talked about the part of you that's kind of doing something for you. Maybe like connection is important to you, so that A+ kind of helped you get connection, especially as a kid, with like your parents, etc. Now we're getting into some therapy work, but that's okay. And so recognizing that, the way that conversation can be relayed, that any practitioner can use, therapist, physical therapist, is it's values work. It's helping a client understand what their values are and what they want their life to look like. So if connection is important to you, and getting A+ was how you've previously always gotten it, but now we know why, because connection's important. Now we can find other ways to help you find connection that doesn't require you pushing through pain.
Exactly. Yeah. So that's when I would, defer and refer out to someone else, to be clear. But in terms of your relationship with your body, I feel like that is territory that I feel comfortable in exploring with patients and clients. Is can we challenge ourselves and our bodies and build them up and do hard things with them, but be more supportive and collaborative and respectful of our bodies and treat them with dignity along the way. And not only, like I said, is that something that I believe we deserve and that our bodies deserve, it's also a better strategy. It also will likely take you a lot further. And this is where it gets a bit tricky with fear. This kind of opens up a whole nother conversation, but just want to throw it in here that a lot of people who aren't as close to the movement side, I guess, of chronic pain. And even those in my field of physical therapy have a misconception, I think, about people who experience chronic pain as those who are afraid to move, or don't have enough courage or grit or will to do hard things with their body. And from my experience, it's been the opposite. And that the majority of people that I see who develop chronic or long-term pain had spent years and sometimes decades pushing through the pain, and before they even get help or seek help. So it's those they often have very high pain tolerances compared to others. And I think fear does play a part, but just not in the way that a person might think. And this kind of goes back to the A plus ideas. It's not so much a fear of the pain or fear of activity. It's the fear of what would happen if I didn't keep pushing through. It's like a slippery slope idea, that if I start scaling back my activity a little bit here, then before long, I'm just going to be, laying on the couch. It's kind of that black or white thinking again. So I try to encourage folks to consider that taking 2 steps backwards can mean 4 steps forward, but it will require a bit more patience. And going back to the other notion about if you have a plan, it's like if you explain this early on, it's like this is what the process is going to look like. It makes them a little bit more open to the notion that, okay, maybe I can scale back on some of my exercise or some of my daily activity for a little while to let my system calm down before I build it back up again.
Yeah. And I think you're describing pacing really beautifully. um, uh, but I think this is important because I think we all hear that term. A lot of us in the pain world, pacing, pacing, pacing. And it's like, what does that mean? And how do we explain it? And then how do we explain it to clients? And there's pros and cons with the different ways that people even try to do pacing. But this is how you explain it to clients and patients is you don't even ever have to say the word. You don't ever have to say pacing in the explanation, but essentially what you just described is how I learned how to pace. It was a lot of like, I came to the conclusion that if I observed how long it took me to recover from a certain thing, whether that was doing the dishes or going on a walk or being at work or whatever it was, it took away some of the fear of like, if I do this, then I'm going to be tired and I can't do this, or I'm going to be in pain and I can't do this. And it was like, actually, everything has a recovery period. So how long does it take you to recover before you can then start doing this other thing that you really love or want to do? And that was a really helpful piece of my journey as well.
Yeah. Yeah. Very good. Pacing is important. It's like, it's the
Yeah.
bear idea, I think, in a way too. It's breaking things down and
Yeah.
for sure.
I know we've talked about pain education, body awareness, compassionate reframing. I would like to talk a little bit about graded motor imagery, like maybe when is that contraindicated and you would stay away from it, and also what it looks like and how it sounds like when it's really effective with patients and clients.
As far as contraindications, because I feel like that's a really good question. There's not a ton that come to mind by the time I might even introduce the activity. By that time, we will have established a bit of a relationship. I've come to know this person well enough to see where they're at with their current physical activity regimen and what they're wanting to do, what their beliefs are about their pain and their history with certain activities or movements that have been painful in the past or occurred, as a result of a big injury or like car accident or something. So once I've gotten to know the person in those situations, and especially if, going back to like the car accident example, if there was like a really severe physical and likely psychological trauma that kicked off the pain that they're coming to me with, or at least was around the time of the onset, then that might be area to tread lightly on with imagery. I wouldn't ask them to put themselves behind the steering wheel in their mind, like on day 2 for that person. I'd want to get to know them more, establish more resources, maybe teach them some mindfulness practices, the breathing, start gently moving their body again if they're able. But if they're not able, as in not able without flaring up their pain without causing more distress for them just to consider it, that's when I might start introducing the idea of doing some imagery. And then I would just tell them about it first and see how they respond. But as far as like straight up contraindications, as long as they have those resources on board, I'm not sure that I can think of any right now. Can you think of any for?
Yeah. No, I want to clarify though, if the imagery, because you kind of said I wouldn't put them like behind the wheel, but I would imagine, well, you tell me if I'm wrong. I was thinking graded motor imagery was more about imagining the movements that you want to do. Is
It's
that
movements
wrong?
or it could be activities. So,
Okay.
because sometimes, and this one really, honestly, it's been a little bit more challenging for me, um, not in terms of education, but in terms of helping folks create a clear plan of progression, is with static long-term positioning. So, long-term sitting behind a desk, long-term travel, standing for long durations, like these are not moving their positions. They're doing things with their body. They're just not really moving a whole lot in those situations, in those examples. So in those examples, I would also use, can you imagine that you're, midway on a flight between New York and London? You're, I don't know, 5 hours into the flight and your back starts to tighten up. Can you picture yourself there? And that's kind of what I mean by that. But most of the time, though, it would be for many a movement like uh, and usually I wouldn't even pick necessarily. I wouldn't pick the specific movement that they're afraid of doing, like maybe for this guy bending over in his spine, like a flexion position, or something like lifting a heavy bag off the floor. I might start with a real broken down version of that. So maybe sitting down, bending forward, and sliding your hands down the front of your legs. That's the imagined movement. So in that situation, yeah, I would do movement. But I mean, I think it just kind of depends on the person to some degree. Um,
Yeah.
Knowing
Yeah.
that putting them back into a scenario, imagining the onset of their symptoms could potentially be uh, very activating for them.
Yeah, I would say that's where the therapy piece comes in. Good trauma therapy, like, and yeah, it would start. I mean, even in somatic experiencing, when we're doing that kind of work, sometimes there's a kind of they call it a T scale, and it's like T0 is where the trauma happened, and we don't even go there, but we might ask a client to remember what it was like getting into their car. Like, let's say they got into a car accident after work. We might ask them to remember what it was like waking up that morning in their bedroom. Like, it has nothing to do with the car, and it has nothing to do with really much of anything except for the day that the car accident happened or something. That's just a very small example. But in that's in trauma therapy. But in the realm of like movement and chronic pain, I can definitely use an example of my own life in which like when it was really really hard to get out of bed, when my chronic fatigue was at its worst, and the pain, the nerve pain was just really really high, and I would just like wiggle my fingers, and that's actual movement, that's not necessarily, but there was an imagery component with it. Like, I would imagine myself just being able to do the very next movement, which was like sitting up, and then it was like putting my feet on the floor, and then maybe walking to the bathroom, and I would sit there for probably 5-10 minutes visualizing that before I could actually get
Mhm.
up. So yeah, that's my experience with some what I think is graded motor imagery. Do you have any thoughts on that?
No, I like it. I haven't thought about. I mean, I like just. So I learned motor imagery kind of one way, sort of, but like I like the idea of just playing with these different ways of incorporating it. So your example of starting with just one movement and then doing that movement and then another movement and then doing that movement. I was like, oh, that's kind of a neat idea, kind of leading yourself along. That's interesting. I haven't really thought about using it in that way before. I think typically I use it for uh, in part for kind of revelation for the person to recognize the degree to which their system, which is just kind of I'm referring to the nervous system more than anything, but I think people kind of get tired of hearing about their nervous system sometimes. So I'll just say their system really doesn't like you thinking about certain activity, or just the thought of doing certain motions can cause a pretty strong reaction in your body. Your body might tense up, your heart rate might go up, you might feel anxiety, or just a little bit of nervousness or anticipation happening, all just by imagining the motion. And that's to again highlight the fact that there's more to your pain than just what you've been told. It's again that gray picture. And this part of it is something we can work on. This is part of what we can do um, to make some headway, is to work on some of that anticipation in the system about certain activities or movements or positions being dangerous for you and unsafe. So can we again, navigate that with a different perspective?
Yeah. 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 I think that, I think that's also a part of it. There's a concept in sports psychology called, I mean, sometimes it's just referred to simply as visualization, but can also be referred to as mentalization. And I know people tend to have the word visualization. Usually people think of like, a guided meditation telling you to like imagine being on a beach. And that's absolutely visualization. But even in the athlete's world, it's if you imagine yourself jumping farther, you physically are able to jump farther. Might be a millimeter further, but it can help. I've done this in the gym where I didn't feel like and this was like a pain fear response. I knew physically I could jump without getting hurt, but this was like right when I was building that kind of confidence. So I still had a lot of fear. And so I remember looking up at the pull-up station and just imagining myself jumping, and then I just did it, and it was like I had to take that split second where the fear was gone to do it, but that mentalization, that visualization helped me like jump up and grab the
Oh yeah,
bar. um yeah.
that's a good example. Yeah, I mean it's been researched in lots of different ways, and I think for performance, it's definitely been researched for several decades now. I think that you can
Yeah.
improve performance, and this is really helpful for athletes like coming back from injury. Um, I think it would also, that's again going back to like the realm of performance and jumping higher or moving faster and uh, getting your agility back more quickly. But it also applies, I think, with the um, inference or interpretation of danger that's associated with the activities. Like if we can imagine doing it enough times, then sometimes it's enough preparation for our nervous system to see that as a relatively safe activity. And I say that a lot, relatively safe or safer, because it kind of goes back to that gray picture. I try really hard not to lead folks to believe that I think that their body is completely safe. Um, Not because I don't
Yeah.
necessarily think it is, but because it can come across as this person is not taking my diagnosis seriously enough, or this person isn't being careful with what I perceive to be or what I believe to be. And my experience has proven that it's not safe to do certain things. So I just want to be clear that we want to approach safer over time. That's where I tend to spend most of my time is helping folks recognize the relative degree of safety that their body parts that hurt um, can be.
I I'm glad we were talking about this. This really goes into the third objective, which is helping clinicians have a kind of common language, whether they're a registered dietitian or a physical therapist or a mental health therapist. When we're talking with our clients around fear of their body or fear of pain, that shows up in all of our clinical offices. And so we need to have a common set of language that we, with variability, like we don't all need to be talking exactly the same. I think that's actually how we've maybe gotten into some of the problems we've gotten in with like the um, behaviorism of, don't talk about your pain, like here's a prescriptive language. But you said something just now, relative safety. That's a big thing in the somatic experiencing world too. We're not trying to talk about, or in the trauma world, I should say, um, to try to just like bring a client into safety when they don't feel safe. They're going to be like, yeah, one, you don't understand my experience. You don't know what's going on here. And so I actually don't trust you now, and you've become unsafe. But relative safety is just a little bit safer than what you feel now. And so it's learning how to talk to patients and clients in a way that is not reinforcing some black and white stereotypes of pain and of discomfort and things like that. I'm just curious what comes to mind for you around language, and what feels important around when you're talking with a client who is experiencing a lot of suffering with their body and their pain.
Yeah. So I think first and foremost, it's important that the person feels like the provider with whom they're working really sees what they're going through, really understands where they're at on their journey. And that takes some time because you have to, I think, earn that trust for that person to feel comfortable enough to really share not only, what's happened to them, but how that's led them to feel, what they've come to believe about their body. So I tend to stay in more of a receiving posture for the majority of the first several sessions working together. Um, and then when it comes to how I speak about,
Yeah, can we expand on that? Like, to have a receiving posture. And what I'm actually hearing is like, it's actually less about, how to talk to patients, and a little bit more around how to just bring a sense of comfort, so that patients and clients can talk to you and you can be in the receiving role. Yeah, can you say anything more about that receiving role?
yeah, absolutely. So one way I like to think about my position in their journey or my role in their journey is to companion them, is to be a companion to them on their path, on whichever direction they're going in, and eventually offer some suggestions as to what you might consider and which way you might think about turning left or right. Uh, but at first, it's just about being on the same page about what all they've gone through. And some of that's just kind of matter of fact, like here's the things I've been told, here's the surgeries I've had, here's the treatments I've tried. Um, and then maybe a little bit more into like, okay, how's this affected you functionally? How is it currently affecting you functionally? What direction do you want to go in? But ultimately getting into that deeper space of what really makes us human, which is the emotional side of it, which, their fears, their doubts, their concerns, their confusion, the frustration and resistance and anger that they might have about all the ways in which they've been poorly treated or feeling betrayed by their own body. And just taking some time to help them come to a place of feeling comfortable enough to share not only what they've gone through, but how they feel about that. So I think yeah, sometimes I found that kind of hard for some people because they just don't want to focus, or they've come to believe that it's less helpful to focus on all the negative feelings or emotions that have developed over the course of their time hurting. Um, so I don't necessarily go fishing for it, but I just try to highlight to them, it sounds like you have a lot of gratitude for where you're at and that you're very determined to get better, and that you are optimistic about the future. And it's been really freaking hard for you for a long time. And it sounds like it's been really confusing along the way. And you've got all these different information, these different pieces of advice or perspective that can sometimes conflict with each other. So just taking the time to really helping them um, feel safe enough to be authentic, and sometimes more authentic than they even know how to be at first, because no one's really taken the time to explore that more thoroughly and from all sides.
And so for you've worked under the insurance model, right?
Yeah.
Can you speak then to therapists and physical therapists who might be listening to this right now thinking, yeah, that might be nice in the private pay world, but I don't have time for that. I have to get this like treatment plan done and out of the way, and insurance want things a certain way. Like, can you speak to that?
Yeah, go cash based. No, I'm just kidding. No, I mean, I worked for almost 10 years in the, well, I've worked my entire career until April of this year in some form of an insurance model, first in skilled nursing and then outpatient, and then for the past 6 years in pain management. And yeah, so I had to get kind of creative with how I wove in these sorts of practices and the way I work with people, the way I educate and coach and hold space and yeah, guide people through different experiences. So it's a tricky thing to say, but I will say this. Built into our codes as PTs is education. It doesn't, as far as I know, specify how much education time to actual movement time does that entail. Because I do take people through movement. I teach them exercises. I'll do manual therapy with them. But I also feel like it's important to, again, like I said earlier, discuss why we're doing these things. What's the intention behind it? How does that how might that shape your strategies and how you go about practicing these movements or these exercises? So I think we can take our time if the setting permits, and that's something I can't really control for, is if you're in a setting where you're seeing 2 or 3 or 4 clients at the same time and working with other professionals like PTAs or rehabilitation techs. I mean, that makes it extra hard, but yeah, I think it's fully within our scope if we take the time to listen and educate, that it would fit into these insurance-based models. In addition, when I was going through the pain certification program many years ago, they encouraged us to use a code that's called neuromuscular reeducation. It's familiar to most physical therapists, and it's the code that we were encouraged to use for pain education, specifically for teaching people about how pain works and the role of the nervous system in that. So I would also, and I know many others who would use that as their code for billing the time spent teaching people about pain, whatever the topic might be that relates to the nature of pain and how that will be impacted by our treatment plan. So those are a few things. I think it's also possible, and I thought about and I did do this for a little while, for those who you've come to realize might need a bit more time to understand these principles, to develop a more wholesome and trusting and collaborative relationship with their bodies, that they might need more coaching. They might need more time for that learning to occur. You could become a coach on the side. I mean, I would recommend anyone that's interested in doing so going through some kind of training. And I went through a training through a company called Well Coaches, and I felt like it prepared me very well to be a health and well-being coach. And I used that, and I did for a long time while I was seeing folks in the pain management clinic. I would see a few of those same people on the side to focus more on these other skills and concepts. So that's another way you might go about it. But just in general, though, I don't think you have to change a whole lot in terms of what you do. I think a lot of it comes down to how you go about it. Being more open and caring and compassionate to somebody going through a very difficult time, and recognizing your own assumptions about what that might be like for them and what they've gone through and what you think they ought to do, and maybe leaving some of that at the door as you can.
Yeah. Thank you. That was a great explanation, a great podcast episode. Anything else that feels like something you didn't get to say?
I'm working on putting together an ebook on this concept of body partnership. It's taking a lot longer than I had hoped, but I want to get that out sooner than later, and I'll advertise that on my different channels. But The idea, though, is that this body partnership model can be applied to calming the body down, to building the body up. And we've kind of talked about those two areas, but also in what I call coming home, or coming home to yourself, which is your body brings you home. It helps you become clearer with what's going on inside of you, both your emotional states, how it might be impacted by your relationship to your physical body and your diagnoses, but also the world around you and your relationships. It also brings you closer to the present moment. And I think that's an important thing that we can all recognize and come to value. But anyways, the last thing I might say about this body partnership model is that it's important to recognize that we all have intentions and mindsets around why and how we're using our body, but it might be important that we revisit those and maybe look at doing them differently. And I think that there are I call them the 5 foundations for this model. And that means that those are body awareness, body intention, body knowledge, body responsiveness, and body relationship. And I think if we're working in those 5 areas and developing a more wholesome and understanding and collaborative relationship with our body in those 5 different foundations, then I think we're going to do right by our bodies for the long term, and also allow us to live the lives and feel like the people that we want to feel like, and be the kind of people that we want to be like.
Perfect. Thank you so much, Jason.
Yeah, thank you.
Thanks for listening. If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need. And lastly, leaving a review really helps others find this podcast, so please do if you found this episode helpful. And P.S., clicking subscribe ensures you'll be here for the next episode. See you then!